Thank the gentleman for yielding. Madam Speaker, I rise today conflicted about what is happening in our government and across the country. Like many Americans, I find myself frustrated with government that doesn't work. Lines that are too long, services that are too hard to navigate, roads that don't get fixed. This shouldn't be a partisan issue. All of us here today should be in favor of making our government work better, of strengthening programs that our constituents rely upon. In fact, some of my Republican colleagues, led by Congressman Tony Gonzalez, write in a letter to Speaker Johnson that the proposed cuts to Medicaid within this budget would have serious consequences, particularly in rural and Hispanic communities where hospitals and nursing homes are already struggling to keep their doors open. One of those communities where hospitals are struggling to stay open is mine in California's Central Valley. Over 450,000 people in my congressional district rely on Medicaid for their health coverage. The Central Valley is also experiencing health care shortage, forcing people to drive across the country, across county lines, across the state, waiting for hours to see a provider. These proposed cuts to Medicaid only stand to worsen the crisis. Let's be clear, these cuts wouldn't just impact individuals covered by Medicaid. In my congressional district, 59% of individuals are covered by California's Medicaid program. That means that doctors and hospitals in my district rely on Medicaid for nearly 2/3 of their revenue. Without that revenue, these providers would not be able to keep their doors open. In fact, Madam Speaker, there is an entire county I represent with a population of 162,000 people who have no hospital at all to go to because it had to close. I submitted an amendment to this resolution to ask a simple question. Is it such a priority to fund tax cuts for individuals with over $1 billion in net worth that we would enact devastating cuts to health care for rural and low-income communities? This proposal would steal from the poor to give to the rich. But even if you don't think that's a problem, Madam Speaker, this literally makes health care coverage worse for every single person living in rural America. I've spent the majority of my career in public service working to make health care better, both more accessible and more affordable. This proposed budget does the opposite. My amendment to the proposed budget would prevent consideration of any legislation that would result in cuts to Medicaid in order to provide such tax cuts. Unfortunately, that amendment was blocked from consideration by members of the Rules Committee last night. To my Republican colleagues who agree that we must protect Medicaid, I hope you'll join me in support of this amendment, should I have the opportunity to offer it here. This is my common sense solution to honor the trust our constituents put in us when they sent us to Congress. I urge my colleagues to oppose the PQ and support this amendment. Thank you, and I yield back.